Intermittent fasting has garnered considerable attention in recent years, and for good reason. It represents a compelling, science-backed approach to improving metabolic health, managing weight, and potentially extending longevity. While new research has sparked concern over its long-term safety, particularly regarding cardiovascular risk, it's critical to examine this data in context rather than rush to dismiss a practice that has delivered measurable benefits for countless individuals. When applied thoughtfully and individualized to suit different lifestyles and medical backgrounds, intermittent fasting remains a powerful and promising tool for modern health. Intermittent fasting, or time-restricted eating, centers not on what you eat, but when. Popular variations like the 16:8 method, eating within an 8-hour window and fasting for the remaining 16, have shown consistent evidence of improving insulin sensitivity, reducing inflammation, lowering blood pressure, and helping with sustained weight loss. These effects aren't trivial. In an age when type 2 diabetes, obesity, and cardiovascular disease are epidemic, any intervention that encourages metabolic rest, calorie control, and hormonal balance without requiring strict dietary changes deserves serious consideration. The study from Shanghai Jiaotong University has certainly raised eyebrows by suggesting that limiting food intake to less than 8 hours per day may increase cardiovascular mortality risk. However, it's crucial to remember that the findings are preliminary and not peer-reviewed. Moreover, the study design itself relies heavily on observational data and self-reported dietary recall over just 2 days, which is a limited and often unreliable measure of long-term habits. Making definitive claims about life-threatening outcomes based on such data would be premature. Even the lead researcher, Dr. Victor Wanzhong, has cautioned that more evidence is needed before drawing hard conclusions. Furthermore, there are plausible explanations for the apparent risks that may have little to do with intermittent fasting itself. People who engage in extreme calorie restriction or irregular eating patterns, especially those who are already at risk for malnutrition, frailty, or chronic disease, might be overrepresented in short eating window groups. This could skew the results, making it seem like fasting causes harm when it may merely coincide with other health issues. The real concern, then, isn't the fasting window, but how it's implemented and by whom. As with any health intervention, context is everything. When done correctly, intermittent fasting does not inherently lead to muscle loss or nutritional deficiency. Quite the opposite. Many individuals report increased mental clarity, better digestive patterns, and improved body composition. Combining intermittent fasting with resistance training and sufficient protein intake can help preserve or even increase lean muscle mass. In fact, some studies have shown that fasting triggers autophagy, a natural cellular repair process that may protect against aging and disease. The issue of lean muscle mass is one area where nuance is often lost. The concern that intermittent fasting might reduce lean muscle is valid if individuals are not consuming adequate nutrients during their eating windows or following an overly aggressive regimen without guidance. But in real-world practice, most people can maintain or build muscle on an intermittent fasting plan if they remain mindful of their macronutrient intake and include strength training. Fasting is not starvation. It's a structured rhythm of feeding and resting the digestive system. Claims that intermittent fasting elevates stress hormones like cortisol or adrenaline must also be interpreted carefully. Temporary increases in stress hormones during fasting can actually be part of a healthy, adaptive response. Many traditional and ancestral eating patterns involve natural fasting intervals, such as going without food between dinner and breakfast. Our physiology evolved to handle these breaks, and possibly even thrive because of them. When fasting is paired with adequate recovery, sleep, and a balanced diet, these hormonal shifts are typically well-regulated and transient. Additionally, the growing interest in fasting is not just based on anecdotal success, but supported by dozens of randomized controlled trials. Intermittent fasting has been linked to reductions in body fat, improvements in cholesterol and triglyceride levels, and better glucose regulation. These benefits aren't superficial. They target some of the most dangerous drivers of heart disease. For many people, fasting is the first dietary approach that helps them build consistency, reduce snacking and emotional eating, and align with circadian rhythms, leading to a deeper sense of control over their health. The real takeaway should not be to abandon intermittent fasting, but rather to use it responsibly. As with any health strategy, fasting must be tailored to the individual. It is not a one-size-fits-all solution, and it is certainly not a quick fix. For people with certain medical conditions, such as advanced diabetes, eating disorders, or pregnancy, fasting may not be appropriate. But for the majority of healthy adults, intermittent fasting remains a safe and effective method when introduced gradually and under medical guidance if necessary. Rather than panic in response to a single observational study, the public should take this moment as a reminder that no diet is universally beneficial or harmful. The same strategy that improves health for one person may not be ideal for another. But intermittent fasting, when practiced thoughtfully, remains a viable, evidence-based option with the potential to lower disease risk, not raise it. Instead of retreating from fasting, we should be refining it, studying it further, identifying which populations benefit most, and educating people on how to do it sustainably and safely.